Hi everyone, my name is Brittany and I'm going to be going over the overview of our project for our International Health Project for this class. Our project is basically covering prevention and helping getting the vaccinations of cervical cancer in South Africa. And the reason why we chose this is because cervical cancer is the second most common cancer in South Africa, with at least half of the cases resulting in death. And so it's a very big issue. It's something that isn't controlled very well there, and we feel like we can do things to help control it more. It targets cervical cancer. It targets women between the ages of 15 and 45 years old, and ends about 288,000 lives every year. So it's quite a bit. According to the World Health Organization, there are 510,000 new cases every year, with 80% occurring in developing nations. So South Africa is definitely one of those nations that's still developing. So half of those 510,000 new cases end in death, and South Africa actually has the largest expanding HIV burden in the world, and it's estimated that about 5.7 million South Africans are currently living with HIV or AIDS, and of those 5.7 million, 60% of those, of that number is women. And so it is very high, and the high prevalence of HIV, although HIV is not cervical cancer, the high prevalence of HIV complicates the situation because HIV-infected women have greater rates of pre-invasive and invasive cervical cancer, and the HPV, which is the human papillary virus, that infection promotes the acquisition of HIV. So a lot of people get HIV, AIDS, or the HPV virus, and they don't know how to deal with that. And so that actually promotes the acquisition, or it can cause cervical cancer in women. And so, like I said earlier, about 60% of the 5.7 million South Africans are women, and they have these diseases or these conditions where they are at risk for cervical cancer. So we can see why it's so high in women there. Cervical cancer, what it is that it's a cancer that occurs when cells begin to rapidly grow in the cervix, the lower part of the uterus that connects with the vagina. So it's obviously, it has to deal with your cervix. Cervical cancer can be especially dangerous since there are typically no signs or symptoms. In the earlier stages of the disease, it's called a silent disease because you can't tell that you're sick until you're very sick. So it's kind of hard to detect that. As the cancer advances, women experience vaginal bleeding, pelvic pain, and vaginal discharge. And cervical cancer can spread or metastasize through the body and eventually lead to death. So it starts in one spot, but as those cells begin to rapidly grow and increase and multiply, they can spread everywhere and can take over organs and cause death, which is really unfortunate. Risk factors for cervical cancer include early sexual activity, numerous sexual partners, smoking, and having a weak immune system. And this disease presents a major problem for South African women, especially without the aid of the HPV vaccines to control this fatal disease, because they don't have access to these vaccines, and they don't know that they're sick, like I said earlier, until it's too late. And so it's, they don't have anything to prevent it, and they don't know that it's something that they should prevent because it's kind of too late when they find out that they have this disease. Practicing safe sex, not smoking, and receiving routine pap smear tests are additional ways that all women can reduce their risk of cervical cancer. And this is also preventable with early detection, screening, and cryotherapy on precancerous lesions that they can find in the body. However, in South Africa, we found that a lot of people did not have access to this, or they just weren't knowledgeable about it, and they weren't motivated to go and get information about this or to get things like this checked out. And so our main focus of our project was to educate women and get them vaccinated, and if anything, just get them educated to know what they can do to prevent the increasing rise of cervical cancer in that country.
This is Rebbe Osai. I'm going to talk to you today about overcoming the barriers that we came across in our research in our program for prevention of cervical cancer among South African women population. The first item we'd like to address is the aversion that South African people have to immunizations. We'd like to address this by getting a sample population and providing them a survey to be able to understand the exact reasons the population is adverse to immunizations. We do address general ideas in our brochure and our poster, but if the program were slated for implementation, we would need specifics. Another key element here is to focus on educating the community health workers and the grassroots volunteers who will be taking the documentation out to the public at the grassroots level, and try to ease their minds on the dangers of vaccines and to assure them that they are really very safe. The second barrier that we came across was perhaps an unwillingness to alter traditional behaviors. So it's important here to recruit the support of religious, political, and local leaders to reinforce our campaign, make sure that they're on board and they get consistent information throughout at every level. This would also require some education and collaborative effort between our organization and, again, like I said, the religious, political, and local leaders. We also plan to incentivize individuals through a cash transfer program so that it will motivate them to get the needed vaccines, screenings, and treatments. The third option, or the third barrier, is that South Africa has a great deal of diversity. So our materials and education would have to be translated into perhaps the 11 different languages that are common in South Africa. We want to make sure that we get information to everyone, and we're addressing this through utilizing community mobilization and getting volunteers to make sure that everyone is reached, touching every community. The volunteers will, like I said before, will need to be trained and educated to answer direct questions, even on uncomfortable topics such as contraceptive use and HIV testing and treatment and safe vaccine practices and those kinds of things. Another way that we hope to address this is through what is called Barai. It's a common traditional activity for communities, which is similar to a barbecue. And so people get together and mingle and make themselves merry and eat. And I figured we could use one of these organizations to, again, disseminate our information and really address the people in the community. The other issue that we're going to try to do is to increase access to treatment and services, and we're going to do this through utilizing the current facilities, the HIV treatment and screening facilities, and incorporate the HPV screenings, HPV vaccines there, and really making those available to everyone, whether if they don't have one of those facilities in each community, then it would be necessary to build one to make sure that they have access even to remote areas. Thank you.
So as we've learned through several facts and findings about cervical cancer and how and why it occurs through extensive research, we've broken it down to three main points and actually interventions that can be taken to protect and prevent ourselves against cervical cancer. That's HPV, HIV, and smoking. So HPV is also known as the human papillomavirus. This is the most common sexually transmitted disease and sometimes has very little signs and symptoms and can be passed along without even knowing that you've been exposed or have the vaccine, or have the virus, except for when it comes to women. The growing rate of cervical cancer due to HPV is significant. There's no cure for the virus, only treatments for your signs and symptoms. The only way to protect yourself from getting the virus is actually receiving the HPV vaccine, which is a 3-series shot. It can be given as early as the age of 9. It's suggested that men and women both receive this in hopes that men will stop passing it along to women, and women will have enough immunity to protect themselves from the virus leading to cervical cancer. HPV is an inactivated, not a live vaccine, which protects you against 4 major types of HPV. It's important that women get this vaccine before their first sexual encounter to start building up their immunity, so if they don't get it before, it actually won't protect them or prevent it at all. If they are exposed and don't have the vaccine, it's recommended to get your first dose at whatever age you decide to start having your first sexual encounter, and the second one 2 months after that one, and then the third one 6 months after that dose. While these women are getting vaccinated, they also need to be getting regular checkups and pap smears to ensure the earliest possible interventions to stop the spread and prevention of cervical cancer. So the next intervention is HIV, which stands for the human immunodeficiency virus. This virus attacks a person's immunity and the immune system and the body's defense against infections such as bacteria and viruses. Once attacked by HIV, the immunity system significantly decreases and becomes deficient and doesn't work properly. By controlling this and reducing and preventing HIV, the incidence of HPV-related diseases will also be reduced. As our second intervention holds a very huge part in cervical cancer, prevention is very important. And these prevention interventions will, as a part of that, we are going to be converting all of the HIV screening treatment facilities to incorporate HPV vaccines, screenings, and all these treatments facilities as well. The third intervention, last but not least, is to quit smoking, or at the very least, reduce your intake of cigarettes and nicotine. Not smoking is a very important way to reduce cervical cancer, pre-cancer, and full-blown cancer. Smoking is associated with the increased risk of developing the squamous and other carcinomas in the cervix that could potentially lead to cervical cancer.
We'll be implementing our 3 interventions through the use of posters, brochures, and a cashback program to create awareness of cervical cancer and to create an incentive for people to act. So the main purpose of the poster is to grab the attention of the community to the issue of cervical cancer, which is why the big statistic is presented at the top. We also want to make sure that we're creating awareness of the 3 interventions to stop smoking, avoiding contact with HIV, and getting the HPV vaccine. As well as providing that general information, we wanted to make sure we provided the website link, which enables community members to act more, to learn more about the cashback program, and to get a hold of the brochures, which provide a lot more information. The brochures are a way for the community members to obtain a lot more information about the 3 interventions. As you can see, each of the interventions have been outlined, and there's some information on the right column talking about the issue of cervical cancer among young women. As well, in the middle, the cash transfer program is outlined, detailing that the community members can receive cash back for doing any of the following actions toward cervical cancer prevention. So they would receive $5 for an HIV screening, and there are other incentives as well. And this is just to start to get the community to act, maybe if they don't fully understand the importance quite yet as they take steps towards prevention, then it can become something that is more common and more accepted in the community. So this is an image of the outside of the brochure, and our main goal is to be able to get these brochures to as many community members as possible so that the awareness of cervical cancer can be well known and the cash transfer program can be well known so that people are talking about ways that cervical cancer can be prevented, and understanding that while prevention is important, they can also earn money from it to kind of accelerate this prevention process in South Africa.